The Medicare Annual Enrollment Period is almost here again. Every year from October 15th through December 7th, Medicare plans take over advertising everywhere. It's impossible to ignore, but it isn't always clear what the annual enrollment period means for you. In this video, we're going to go through what you should do every year during the AEP, what you can do if you choose, and what Medicare plans are not affected by the annual enrollment period. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new helpful Medicare content every week. The annual enrollment period occurs every year between October 15th and December 7th and applies to Medicare Advantage plans and Medicare Part D plans, but does not apply to Medicare Supplements, also known as Medigap policies. So first, what should you do during the annual enrollment period? If you are in a Medicare Advantage plan or a Medicare Part D plan, you will receive an annual notice of change document from the insurance company by September 30th. Take a little time to review the changes that your plan is making for the new year. Although the whole packet from the insurance company may be huge, there is usually a clear summary of changes document that is a good place to begin. If the changes for the new year don't affect you, you can stay in your plan for the upcoming year by doing nothing between October 15th and December 7th. Your coverage will continue in the new year. However, if you find yourself in this situation, it's still a good idea to look at all the other plans being released in your zip code for the upcoming year. Since the plans can change every year, there might be another one that has become a better option for you than what you currently have. If your current plan's changes will affect you negatively, you should definitely plan to look at other options available in your zip code during the AEP. Here are some things to look for in your annual notice of change. If you have a standalone Part D plan, check the monthly premium, the annual drug deductible, the pharmacy network. Is your pharmacy going to be in the network in the new year? And your medications. Did the tier level or coinsurance or copay amounts for any of your medications change? And are there any new restrictions on your medications? If you have a Medicare Advantage plan, check the monthly premium, any deductible amounts, the out-of-pocket maximum for the year, the provider networks, are your doctors remaining in the network for the new year, and copay and coinsurance amounts for services that you routinely use or services that you expect to use in the new year. If you are in a Medicare Advantage plan that includes Part D coverage and MAPD plan, you'll need to look at all of the above in your annual notice of change. Also, communicate with your doctor's office. Some doctors and medical practices change networks from year to year or decide to only accept certain types of Medicare plans for the upcoming year. If your doctor is doing this, you need to know during the AEP. Next, what can you do during the annual enrollment period? Number 1, switch from one Part D plan to another. This is very common and easy to do. Part D plans can change every year, so the one you enrolled in last year or 5 or 10 years ago may no longer be your best option. Enrollments are handled online or over the phone and are quick and simple. Number 2, switch from one Medicare Advantage plan, MA or MAPD, to another Medicare Advantage plan. Like I said earlier, if changes to your current plan will negatively impact you, or if changes to other plans make one of those a better option for you, it's easy to enroll in a new Medicare Advantage plan for the new year. Number 3, switch from a Medicare Advantage plan that has prescription drug coverage to one that does not. If you have creditable prescription coverage from another source, this may be a good option for you. If you don't have creditable drug coverage, this is not a recommended action. Without creditable coverage, if you choose to enroll in a Part D plan or a Medicare Advantage plan that has Part D coverage later, you will pay the Part D late enrollment penalty for the entire time that you were without creditable Part D prescription drug coverage. Number 4, switch from a Medicare Advantage plan that does not include Part D coverage to one that does include Part D coverage. In this case, you will need to provide proof of creditable drug coverage to avoid paying the Part D late enrollment penalty. Number 5, switch from original Medicare with a Medicare Supplement and Part D plan to a Medicare Advantage plan. If the new Medicare Advantage plans for the year are a better fit for you than your current coverage with Original Medicare and a Medicare Supplement and Part D plan, you can enroll in a Medicare Advantage plan that includes Part D coverage during the annual enrollment period. If you choose this option, your standalone Part D plan will be automatically canceled when you enroll in the Medicare Advantage plan, but your Medicare Supplement coverage will not be. So you will need to contact your Medicare Supplement insurance company and request that your insurance coverage be canceled on December 31st. Number 6, leave a Medicare Advantage plan and return to Original Medicare. If no Medicare Advantage option for the new year works for you, you can leave your Medicare Advantage plan and return to Original Medicare Parts A and B during the annual enrollment period. However, be aware that you may not be able to purchase a Medicare supplement to cover the gaps in coverage that Medicare Parts A and B have. More on that in a moment. Stay tuned. Number 7, enroll in a Part D plan. If you are leaving a Medicare Advantage plan to return to Original Medicare, you can enroll in a standalone Part D plan. Number 8, drop Part D coverage. During the AEP, you can drop your standalone Part D plan. This may be beneficial if you or your spouse has coverage through an employer that provides creditable drug coverage and makes your Part D plan unnecessary. Be sure what is provided is creditable coverage before dropping your Part D plan, so you don't end up having to pay the Part D late enrollment penalty if you enroll in a Part D plan again down the line. Those are the things that you can do during the annual enrollment period. Whether you make any of those changes on October 15th or December 7th, or any date in between, all changes will be effective on January 1st. One note, generally you can't be enrolled in a Medicare Advantage plan and a standalone Part D plan at the same time. The only exceptions to that are some private fee-for-service plans, medical savings account plans, cost plans, and certain employer-sponsored Medicare health plans. Finally, what Medicare plans are not affected by the annual enrollment period? Medicare supplements, also known as Medigap plans, do not fall under the annual enrollment period. These are much older plans that follow different enrollment rules. You can change your Medicare supplement during any time of the year. However, in most states and under most circumstances, you will need to answer a list of health questions and provide a list of your medication and pass health underwriting in order to be approved to purchase a new Medigap plan. There are exceptions based on state laws, and there are some guaranteed issue Medicare supplement companies in some places that will accept anyone who is 65 or older and has Medicare Parts A and B. But don't assume that if you leave a Medicare Advantage plan and return to Original Medicare during the AEP, that you will be able to purchase a new Medigap policy. That is definitely something to look into before leaving your current Medicare Advantage plan. The health questions for Medigap underwriting do vary from company to company, so a broker will be able to assist you in finding a company that is likely to approve your application if at all possible. If you are thinking of leaving your Medicare Advantage plan during the AEP and are interested in purchasing a Medicare supplement, start the process early. If you apply for a Medigap plan on October 15th with a January 1st effective date, which is the earliest date that you can leave your Medicare Advantage plan, you should have an answer as to whether you are approved by the Medigap company with plenty of time left in the AEP to apply to a different Medicare supplement company if necessary. What if you have a Medicare supplement policy that you're happy with? Medicare supplement plans are guaranteed renewable as long as you pay your premiums, and they do not change benefits from year to year. You do not need to do anything during the annual enrollment period if you want to keep the Medigap plan that you have. If you have questions about your Medicare coverage and what you should be doing during the upcoming annual enrollment period, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to help you have a stress-free AEP and make sure that you are in the best Medicare plan for you based on your unique situation. Have a great day.